So, welcome to the Barcelona Cybersecurity Congress Digital Summit and the roundtable entitled Healthcare Cybersecurity Incident Response in the Spotlight. We will be taking questions from the audience today's session. If you'd like to ask us a question, please type it in your dashboard and we will answer you via test chat during the session. My name is Juan González and I am the manager of the Catalonia CERT at the Cybersecurity Agency of Catalonia. At the agency, we work to grant cybersecurity in the whole region of Catalonia, and our CERT is one of the main tools we have to achieve that goal. As a response team, we handle cybersecurity incidents in a wide range of environments on a daily basis. Our constituency currently covers the government of Catalonia, but also includes, among others, city councils, universities, research centers, public companies, and hospitals. It is precisely this last type of organizations that have been targeted by many different types of malicious actors in these last years, which is particularly worrisome under the current pandemic situation. Today, we are happy to welcome two colleagues that have played a crucial role in the healthcare arena here in Catalonia for a long time now. Albert Aro is the Chief Information Security Officer at the Health Department of the Government of Catalonia. Good afternoon, Albert. Would you please introduce yourself?
Yeah, sure. Good afternoon, Juan. I am very happy to be with you today. I am Albert Aro, as you said. I'm Chief Information Security Officer in the Cybersecurity Agency of Catalonia for Public Health Care. Thanks a lot to the organization for the invitation. It's a pleasure to be here today and to share with you our experience and my thoughts about the challenging situation we are living today dealing with cybersecurity incidents in healthcare sector. I work together with Catalan Health Department, the CatSalut, and the main stakeholders of a health public service in Catalonia in order to deploy a cybersecurity model that ensures the protection of the main assets of public healthcare. The National Health Service in Catalonia is governed by the Department of Health that established the health plan, and the CatSalut that contracts the healthcare services to a very rich and diverse group of healthcare organizations, including public institutions as well as private centers. We work together in order to create a network of security professionals and technology that ensures cybersecurity protection and governance. Collaboration is essential in the world that we are living. We look forward every day to give cybersecurity value to health ecosystem, but also to empower the organizations to manage cybersecurity risks and to face the increasing number of incidents that uses techniques more advanced and persistent than ever before.
Okay, thank you, Albert. And then we also have Marta Carbonell, which is the Technology Deputy Director at the Catalan Institute of Oncology. Hello, Marta, and thank you for joining us too. Could you please tell the audience a bit about yourself?
Hello, Juan. Thanks for the introduction, and thanks to the organization for inviting me to this event. My name is Marta Carbonell, and I'm currently Technology Deputy Director in the Catalan Institute of Oncology, in charge of the IT department. And previously, I have had the same role at Vallebrons University Hospital. In both posts, cybersecurity is of the utmost importance for the blocking impact that any incident affecting availability of IT systems and technology can have in the healthcare institution's daily operation, and the high sensitivity of the personal data that we deal with. In this area of cybersecurity, we have the support of the Catalan Agency of Cybersecurity, and we have been working with Juan and Albert in incident response.
Okay, thank you, Marta. So if everybody's fine with it, I think I'll go ahead with the questions. I'm gonna make one question to each of you, so please feel free to develop your thoughts. So Marta, I'll start with you. When dealing with cyber threats and responding to cybersecurity incidents inside your organizations throughout 2020, what have been the main challenges you have faced?
Cyber threats and security incidents are one of those events that come without warning. So you must be prepared to change your plans and give maximum priority and attention to them. So as last year we were a little busier than ever adapting to the new needs of the that COVID-19 had aroused, it was very important and it was challenging to get time and resources to deal with them and identify the key tasks to be focused on them, and most of all to be able to keep the tension, to keep things going once the critical point was surpassed, to have the continuous improvement plans going on, and having legacy systems upgraded and everybody connected to the point that we should achieve better security than before. So we have an advantage. Hospitals are used to run 7/24 systems, so we have continuity plans in place to allow us working without system if it's necessary for a time. And that's something that has acted as a safety net, giving us calm and quiet to go on managing anything that happened. But on the other hand, each time we are more dependent on digital technologies. And we have less paper that makes things more immediate, but make also services more critical.
Very interesting. Thank you, Marta. And then Albert, if you want to go ahead, please.
Yeah, sure. Well, the response to COVID-19 pandemic was clearly been the priority for the healthcare system during 2020. And in addition to that, the pandemic has driven a huge digital transformation of the healthcare sector. One of the main challenges for me has been that remote work and telemedicine has emerged fiercely. IT systems that were only used internally had to be accessed from outside the organization. Virtual desktop, VPNs, etc., were implemented in a time record. Another area that has experienced an important growth is cloud solutions that has provided elasticity and fast access to new services, but also has brought challenges to deploy the cybersecurity perimeter. This situation, in addition to stress the professionals and the system, has increased the surface of exposition and so that the cybersecurity risks. It is also worth to mention that from my point of view, it's worth spending time and money in prevention, implementing key measures to reduce the risk and impact of cybersecurity incidents. However, it is true that the response to cybersecurity incidents during 2020 was also a big challenge.
Okay, thank you, Albert. Very insightful. So now a new question for you too, Albert, sorry. With the healthcare sector under great pressure, and now that the number of cyber threats targeting it is larger than ever, what do you think are the main threats organizations should be worried about?
I believe that main challenges have been facing has to deal with phishing threats, ransomware attacks, and also keeping up to date the systems in order to solve vulnerabilities. Phishing has been the main method of attack on the healthcare industry, and during the pandemic has exploited the stress and lack of awareness in cybersecurity. During 2020, phishing attacks against Catalan healthcare sector have been increased almost 200% compared to 2019. Spear phishing, which is more elaborated and targeted, we have seen that has a probability of success higher by 75%. Usually, the target is credentials theft, but also malware infection and business email compromise type fraud. In 2020, the healthcare sector has been the main target of ransomware, with almost 20% of the attacks received. these attacks has incorporated the technique of double extortion. That means that not only to encrypt the information, but also to threat of spreading sensitive information. We have identified that 70% of attacks were made through RDP or VPN connections, so highly deployed during the pandemic to telework, and around 25% through phishing emails. Dealing with vulnerabilities has also been a big challenge, not only to the new vulnerabilities that appears more and more often, but also due to the complexity of the healthcare environments that uses very diverse software and multi-year-old devices.
Yeah, okay. I'm afraid ransomware is going to be a main threat for the years to come. So, yeah. Marta, what do you think are the main threats that the organization should be worried about?
I agree with Alberto about the attack vectors. Phishing has been really something we have had to worry a lot about. I think that each day we have phishing. We detect phishing mails that are sent to our professionals, and we are intensely sending information and communicating all stakeholders to be aware not to click on these emails and spread the threat, because then you have first of all you have denial of service attacks in the email servers, and afterwards you can have ransomware. You have more other effects or side effects that are affecting us. But I think that, in my opinion, the most important threat is about data leaks. Okay, all the information we are handling in our institutions is very sensitive, and it's economically it can be
devastating, I guess. Yeah.
And these threats are often more difficult to detect because you can have had a data leak and you can see it afterwards, and it can have a big impact in personal rights and also in institutional reputation. I think these are much more dangerous.
As Albert was mentioning before, like this double extortion threat, like you may get the ransomware, but you also have your data leaked and published, and that's an impact, definitely. Yeah. Okay, so next question is for Marta too. How do organizations prioritize cybersecurity in the current pandemic context? How difficult is it now to find some extra leverage inside your organization?
Well, with the pandemic context, we've got more teleconsultation, telemedicine, more devices than ever connected to our systems. Remote work has been adopted massively and has allowed some new points of entry to the attackers. So it has exposed us more than ever. But at the same time, there have been a lot of news in the media that all the people in our organizations have seen, and it has helped us find more leverage inside the organization because risk awareness has aroused. And it's easier now to talk to the board and explain which problems we have with risks and the need to invest and to invest time and materials. I mean that sometimes it's time-consuming tasks that we have to do to upgrade systems, to reach better security levels. As zero risk never exists, we could do things from now to infinite, but I think that at this moment it's much easier to get a security plan in the move.
Yeah, I bet they know what it means when they hear about cybersecurity threats, incidents, because it's in the media, as you said. So yeah, what do you think, Albert? How do you think organizations prioritize now cybersecurity? I mean, is it easier or more difficult?
Well, I share my point of view with Marta, but I would like to add to that I believe that one key issue to have in mind is that cybersecurity is not only to help to reduce risks, it also can bring trust and confidence in services and institutions. I truly believe that a cybersecurity function within the organization is needed, and it should be at the highest level of management level. But it's also true that for small organizations, it is highly difficult. No, because they don't even have a dedicated IT team very usually. We see that most of the time cybersecurity responsibilities are inside IT teams. However, it is important to have a direct reporting to management. Using language of risk is very useful. Avoiding technical details and focusing in possible impacts, because we are managing risks, and so that appropriate language is important.
Definitely, yeah. We can see that from the cert. We are technical animals, and we like to be like in the low level speaking techie, and yeah, it's definitely worth and useful. I mean, when you understand that you need to module your language and talk to the C levels. So yeah, definitely, I agree.
But I truly believe that the Catalonia has improved a lot during that month.
Thank you, Albert. Yeah, we are working on that. So yeah, next question, Albert. What do you think will be the most common attack vectors in the years to come now?
Well, I believe that obsolescence in public healthcare sector is really a challenge. We are in an environment where organizations struggle with budgets, constraints, and technology, and security are often seen as not a priority. In addition to that, the lifetime of medical devices is usually very long. Well, but let's try to be a bit positive, and I believe that with the pandemic, we have seen that healthcare is really a very strategic sector, and also there is a regulation, no, the medical device regulation, with which is in place from a few years ago, that in the Annex 1 it defines the cybersecurity responsibilities for the providers, and they ask them it asks them to address cybersecurity risks. So, and another thing that I think is also very important is that in order to minimize the VPN related breaches, organization has to pay attention to keeping up to date the systems to avoid vulnerabilities, and one of the key security measures also is to implement multi-factor, at least for privileged users. Generally speaking, I believe that phishing, ransomware, and patching the systems will continue to be the main challenges for the following years.
Okay, yeah, totally agree. Marta, what do you think about the most common attack vectors in this 2020 and the following years?
I think that this may be a little boring, but I agree with Albert, because, for example, phishing is one vector attack that has a wake point. That's the human interface. You have a person that interprets, and it's more easily fallible than an automatic system. So I think that phishing attacks will go on. And in the e-health, in the health sector, we do have this problem about lifetime of devices in contraposition with the living time of operating systems and IT. We have a real challenge in keeping everything upgraded. In new acquisitions, we can try to adhere to the recommendation, for example, that the European Cybersecurity Agency has sent for procurement of medical devices. So we prepare and we have a maintenance plan to keep everything up to date. But we do have a lot of medical devices already in place. And it's not easy to change the information systems that are aside them. And it's not easy because of cost, because of time, and because sometimes you have to stop the service to do so. It must be done. All of us have a plan, but it's not easy. I think that's really a challenge, and it's a place where threats can come in. And also, you can't forget we are in buildings, and each time more you have all the buildings connected, SCADA systems, IoT devices, sensors that tell you which temperature refrigerators are that we have to monitor. For example, for the vaccines, to know that everything hasn't changed temperatures and so. And this kind of equipment is very difficult to have a proceeding to ensure that the default users are always changed. It's something to work on.
Mm-hmm. I totally agree. I think there's a lot of work to do, and it's going to be interesting to work in cybersecurity in the following years. But anyway, I mean, you keep talking about continuity plans and referring that there are a plan B, and that's good to know, at least from a user point of view. But yeah, I guess I'm sure if you have to go to that plan B, things are going to be much difficult for everyone, even though it's not the end of the world, but it's going to be hard anyway. Thank you, Marta. Next question for you two. I think that this might be the last one, probably. I don't know if we have time for another one, but anyway. Which 3 key steps do you think must be considered in order to decrease the likelihood of suffering an incident?
Mm-hmm. In order to decrease the likelihood of suffering an incident, I would say updating systems, having a tight users policy. I mean, when you create a user, which accesses you give, how is the exiting procedure also, and reviewing all the new gadgets, medical equipment, building, sensoring, everything that you get inside hospitals, having into account cybersecurity needs. And once the incident could be in place, if we have everything traced and monitored and have activation procedures when an incident occurs that send us to the organization and the way we are going to manage the incident will reduce the impact and help us recover promptly.
So yeah, that's about having plans in place, right? Like checked and validated, so everyone knows what to do when the bad things happen. Yeah.
Mm-hmm. And protocols.
And protocols, yeah. That could be really helpful, yeah. Albert, what do you think are the main? I think you have already said something about 3 measures or 3 things to do, but anyway, which are the 3 key steps you think that must be considered to reduce the likelihood of an incident?
Yeah, I spoke previously about what I think are key measures. Marta also explained a very good approach, highlighting the important things to take into account. Let me give you another approach, just to, in order to have a bit of more diversity. For me, if there is a new company and you start from scratch, the first step will be to identify what are the critical assets you have in the organizations. The people, the critical services, etc., and to evaluate main risk you are facing. No, for me, it's the first step. No, knowing what is important for you. The second step will be to deploy a cybersecurity perimeter to protect that critical assets, to reduce the risks that we identify vulnerabilities and to correct them. And let me insist in key measures because
Yes,
I think
please.
it's important to have this in mind. For an organization to have backups offline are essential because most of the time we have seen that the backups when you have an incident are also encrypted. So have one copy of the backup offline is one of the key important things.
Absolutely.
Multi-factor authentication solutions. Well, now it's a must. No, passwords only solutions are really obsolete today. It's really very weak having an authentication method based only in password. And also having in mind that we will all the organizations have an incident, we have to implement monitoring systems that allows us to identify the intruder before the impact is big. No, we have to monitor the flows and these kind of things in order to detect, also using honeypots, etc., in order to detect the incident as soon as possible. Well, we have to think that we have very often seen that an incident start weeks or even months before the final ransomware is launched. No, we have this intruder working inside our organization with lateral movement, deploying persistence, etc. And it's important to have this in mind and to have no this look at our infrastructure thinking that this can happen. And of course, for me, the third step is to be prepared for incident response, because sooner or later we have to
It will
manage
happen.
one incident. It will happen, or if the companies that say that they didn't have any incident is because they are not aware of it, because everybody has incidents, of course.
Yeah, it's the same, but yeah, it's nowadays it's really hard to avoid this incident from happening. As you said, I mean, I think you two have gone through many very valuable measures to take into account and to apply. It's not strange the day that we don't see an organization that have been entered or breached by leveraging an existing set of credentials. So if you don't have multi-factor there, they can use the credentials. Then they get into the organization. They move laterally, as you were saying, Albert. Then they finally decide to deploy that ransomware. And if you don't have those backups, offline backups, the havoc is to happen. And also, of course, it's necessary to have eyes on what's happening inside your organization, to be able to react, to be able to know what happened before. Yeah, definitely. I think I mostly agree with all that you say from the incident response point of view. So, guys, I think we are running out of time now. I think we are gonna wrap it up. Once again, I'd like to thank you both for being here today with us, and also thank the organization and all the audience. I'm not sure whether you want to add something or just say goodbye.
Please, Marta.
Thanks, Juan. I just want to say that it has been a pleasure to be here, and it's very easy to learn things being this in this kind of summits.
Well, I will say more or less the same because it has been very easy and a pleasure to be here. It's I learn always a lot with working with you. Thank you very much.
Okay, let's hope we can repeat this in person, not remotely. Take care now. Thank you for being here, and see you. Bye bye.
Yeah, thank you.
Bye.
Bye.